So yeah, I'm also from Calgary, Alberta. I went away for about 8 years to do my schooling out in Saskatoon, but I'm really happy to have returned home back to the mountains, which I really love. And my hobbies include things like camping, hiking, trail riding, and traveling. Bottom picture in the left-hand corner is the very first iceberg I've ever seen in person, which is out in Newfoundland this summer, which is really exciting. Happily. So, kind of back to our topic, discussing biosecurity. So what is biosecurity? So biosecurity is a set of procedures or protocols that prevent the introduction or spread of diseases, so things like viruses, bacteria, fungi, or parasites, between animals, or between your horses, or between your horses and yourself, because there are some things that can actually spread from your horse to you, so good to know. We also don't get sick. So why is biosecurity important to us? So many equine infectious diseases are a result of things like contact with other horses, either in transporting a trail, so you're trailing your friend's horse as well as your horse somewhere, at events like shows, or during just a regular turnout. If you're turning out your horse in the field with other horses, there's always the risk that they can contract things from other horses out there. And disease often has a very significant financial, performance, and emotional consequences. Some of these infectious diseases can even be fatal. So it's always a good idea to be aware of them and to know what things you can do to prevent either your own horse from getting it or from spread to multiple horses on the property. So how can we be biosecure? There's basic prevention that you can do. Just right off the bat, easier to do at home. So the biggest one that we always recommend is vaccinate and deworm your horses on a regular basis. Obviously, there's lots of different things you can vaccinate your horse for, and you've got lots of options. But there are specific diseases that can spread specifically from your one horse to another horse, instead of, say, through like a mosquito vector. And the most major ones that we worry about are strangles, and then our flu and rhino, so our equine herpes virus and our equine influenza virus. And those ones are really important if you, say, take your horse to shows, or if you have you're having a horse at a facility where there's a lot of movement of horses on and off the property. Those ones are often when we really recommend horses get these vaccines. And another important thing is if you buy a new horse and bring it onto the property, you would always want to quarantine it if you possibly can. Ideally for 30 days, but for at least for 2 weeks, so that you can monitor them really closely for any development of any symptoms that I'll be discussing further on in the presentation, so that you're not just immediately throwing that horse in with your horse, and all of a sudden they end up with a cough and you're going, oh no, all the rest of my horse is going to get this cough as well. Additional prevention is education. You guys all showed up tonight to learn about all sorts of things, so I think education is a really important part of biosecurity. So you can learn about the different diseases that you need to be worried about, as well as the different protocols that you can implement. And so ask questions of your vet, ask questions of each other. If you've dealt with different situations on your farm and know things that have worked well for you, you can pass that along to other people. And just like with us, hygiene is really important. So when you're trying to prevent yourself from getting a cold, washing your hands, making sure you're not touching your face, etc., is really important. So we recommend that you clean your buckets, your halters, your stalls and pens, and other things that are coming in contact with your horses on a regular basis, so they're not collecting all that bacteria on them and spreading it around the facility. And then for anybody who is breeding or has foals, we really recommend that you don't just, the moment that your foal has been born, just throw it in with a whole bunch of other foals, because they can transmit diseases to each other pretty easily. And we also recommend that you don't mix foals of different age groups. Don't throw your 3 foal in with your 3-month foal, because there's potential that they can transmit things between each other. So that's kind of the basic biosecurity that you should be kind of implementing on a day-to-day basis. And then there's a more advanced biosecurity. So if you have one of your horses, or one of the horses on your property, develop one of the symptoms that I'm going to talk about later, this is when you want to go full meal deal. So the biggest thing, if you notice those symptoms, you're going to want to separate that horse right away. Don't be like, I'm just going to wait for a day until it's more convenient. Just right away, separate that horse. ideally as far away as possible. Some respiratory viruses can spread as far as a kilometer in the air. I know that's not feasible for a lot of people. Most people don't have a kilometer worth of land. But basically, as far away as we can, and really want to prevent any nose-to-nose contact. So making sure you have at least a stall or a pen in between that horse and the other horses on your property. And when you're working with that horse, you want to interact and feed it last, so that you're working with your healthy horses and then moving to work with your symptomatic horse after that, so you're not going backwards and potentially transmitting things to your healthy horses. We recommend that you wear gloves and wash your hands, potentially shower. If you're interacting with symptomatic horse 5 times a day, probably not going to be able to shower 5 times a day after working with that horse. But if you're only working with them once, best to shower after, because that's going to reduce your risk the most. And really make sure to wash your hands, because there are things that can transmit to you. So I know the big thing that they always tell us in vet school is you chew your nails, when you lick your hands, you're going to have a great time someday. So make sure to wash your hands. And we do recommend that you wear specific clothes or have a set of coveralls and specific footwear for when you are working with that symptomatic horse. You want to use separate equipment for that symptomatic horse, so having a separate set of brushes, separate halter, separate feed and water buckets, blanket if it's winter, and then one thing that people don't often think of is having a separate manure fork and wheelbarrow that you're never bringing in with your asymptomatic horses. And then you want to put signs around that isolated pen or stall, especially if you have a big facility, because someone could show up and not be thinking that day. You told them over email, but they just go and pet that horse and then immediately go work with their horse. So having obvious big signs around there just to make sure that people aren't interacting with that horse unless they're using the appropriate biosecurity. And then we also really recommend that you monitor your other horses really closely for any development of symptoms. And you can take daily rectal temperatures to help monitor for a fever, because a fever is often associated with a lot of the things that we worry about. So things like greater than 38.5 degrees Celsius in adults, and then greater than 39 degrees Celsius in younger foals. And finally, disinfectant. Disinfection is also really important. So having a foot bath outside the stall or outside the pen, and a spray bottle for your equipment. If you do need to, absolutely transfer a piece of equipment between that horse and that one, you want to make sure that it's super well cleaned before it goes to your asymptomatic horses. And what disinfection would you want to use? I know at bird wash, we use Virkon, and it's actually been shown in this 2014 study to be the most reliable disinfectant for any sort of changing environmental or temperature conditions. So for people out on farm, that's probably the best one to use, because there's such a variety in terms of outdoor temperatures, the soil type, etc. So that's probably one that we would recommend you guys use. And use it in spray bottles or foot baths, and we would recommend a contact time of at least 10 minutes on that equipment before you wipe it or rinse it off. So now that I know it sounds like a lot to have to do, but I just want to remind you guys that a lot of these things that we would want to be going biosecure for can be fatal, can be really bad economical, financial, or performance consequences. So really trying to prevent it from spreading to all your horses, or even just your horse initially is really important. So what kind of signs or symptoms would we want you guys to go biosecure for? So if you see any sort of diarrhea, so contagious causes that we worry about in adult horses, things like colitis. And colitis is one of those things that can actually be fatal if you don't treat it. So that can be a bacterial one, so like a salmonella or a clostridia. Those also transmit to people. So that's why you want to definitely be washing your hands after. And coronavirus is also another one we worry about. And then in foals, diarrhea is super detrimental in foals. They can get dehydrated really quickly. So that's one that we want to really prevent from going through our whole foal population if you've got multiple foals on farm. And that can be a rotavirus, an E. coli or clostridia. And then cryptosporidium is the one that we always get taught about in vet school, and that's the one that if you chew your fingernails, crypto's going to be your friend at some point. So we really don't want that one, either going to yourself or to your other animals. And this one is a fecal-oral transmission. So if you have a horse or a foal that has diarrhea and you have them in a group, we also would potentially recommend recommend moving your asymptomatic horses to a different area where that fecal contamination isn't present on the ground. So respiratory signs are another thing that you want to look for. So things like coughing, nasal discharge. Sometimes you can get eye discharge along with those signs as well. Increased respiratory rate at rest, and then lumps in the throat latch area. So on the right, there's a picture of kind of where you would look for that sort of swelling. And contagious causes that we worry about are, our flu and rhino, so our equine influenza virus, our equine herpes virus, and the infamous strangles that I'm sure a lot of you guys know about, and then equine viral arthritis. And those are spread through nose-to-nose contact or through aerosolized droplets. So if you're sneezing or coughing, they can spread it a bit farther. So these are the ones that we would really, really recommend you have as far away as possible from each other. Another sign or symptom are neurological signs. So this thing you can see with incoordination, urine dribbling, weakness or inability to stand, muscle tremors or spasms, or abnormal behavior. And the two kind of major contagious causes that we worry about are equine herpes encephalopathy, which develops from equine herpes virus 1, and then rabies. Both of these are basically fatal in horses. So these are important ones to know about. So if you see these, you want to isolate your horse immediately. And then skin concerns. I don't know if anybody has dealt with any skin concerns this year, but things you look for are hair loss. Sometimes you'll see some crusting associated with that, itchiness or sores, and again, ringworm, lice, or mange. And those things can spread very easily to each other, so especially you don't want to be using brushes or halters or anything that is touching the horse on another horse, because that will definitely spread. Again, fever can be a sign of multiple different infectious causes. If you check your horse's temperature every once in a while, you see a fever, or you're seeming like, oh, they're a little bit off, maybe I'll check their temperature, and you get fever, that's when we recommend that you would isolate. And then for anybody who's breeding, if your mare aborts, all of a sudden, there are some contagious causes that can cause abortion in a mare. Things like equine herpes virus 1, sometimes the equine herpes virus 4, and then equine viral arthritis. And especially with that, just like with diarrhea, if you have a mare abort in the field, we recommend that you remove all of that material as soon as you can, and preferentially, if you have the ability, move your other pregnant mares who are in the same field to a different field so that they can't come in contact with the fetal membranes or anything like that. So next steps. If you see any of these symptoms, you're going to do all of those things, contact your veterinarian staff, especially if you have a foal with diarrhea, because they are the ones that can go downhill the quickest. Hours really count if you have a foal that has a significant diarrhea, because they can get dehydrated so quickly. When you contact your veterinarian, they'll ask you some history questions, see what we're dealing with, asking you signs and symptoms, and based on that information, they may recommend diagnostics such as physical exam, blood work. If you've got a respiratory concern, they'll likely recommend nasal swabs, potentially a transcatheter washer, bronchial or lavage. If you've got skin problems, the skin scraping, people call it culture via the diarrhea, and then ultrasound depending, respiratory or diarrhea. And then if we have suspicion of strangles, we may recommend an endoscopic exam of those bowel pouches and to help us test for that. And then also depending on what they discuss with you and potentially what they find on those diagnostics, they may recommend hospitalization, especially for things like a colitis, or any foal with diarrhea, we're likely going to recommend that you bring them in for further treatment. But if it's something that we are just testing them with a nasal swab to see what they have, we may just recommend that you monitor and treat them on farm while maintaining that appropriate biosecurity until we get the results of whatever tests that we've done. Well, thank you guys very much.
I have a question.
Yes.
Is scratches a virus that is transmittable horse to horse?
It's more of a bacterial dermatitis situation, so it's more associated with the environmental conditions. So I would say obviously, you may not know it's scratches, so I'd say treat any skin issue as if it's contagious until you know what it is, essentially.